Anambra. It is my pleasure once again to update you on the efforts of our dear state in taking to protect our people from fast spreading COVID-19 pandemic that is ravaging the world today. As you are well aware, long before we recorded our COVID-19 index case on April the 9th of 2020, we had made some commendable arrangements that would give us a fighting chance against this pandemic. We have put together 428-bed protective care center to absorb COVID-19 cases and nurse them back to good health. We have made elaborate arrangements to fight this pandemic. We have fumigated all our statutory markets in Anambra State and distributed palliative materials to segments of the society, primarily the very vulnerable 70 and above and the youths. We have also continued to emphasize the strict adherence to all the COVID-19 protocol, which includes heavy use of nose masks, frequent washing of hands, regular use of hand sanitizers, and maintenance of social distancing. COVID-19 case in our protective care centers. In Anambra, out of the many tests we have conducted so far, we have recorded 9 positive COVID-19 cases. 4 of these cases are currently in our protective care center. One of the cases was accompanying a corpse from Lagos to a nearby state when his sample was collected by our COVID-19 team for testing. Before the result came out, the guy has moved on to the neighboring state, and because we collected his phone number, we communicated with him only to find out that he's already in Lagos where he resides. You know, the Lagos authority has been already alerted on this very case. 3 of the cases have been discharged. 3 of the cases. That means in this case and 2 more of the cases that we have, they have been discharged as we speak. In the Anambra, it is important to explain here that the only COVID-19 death that we have recorded so far was a 66-year-old man who did not report ill at any time. He went to a private clinic where our COVID-19 team were invited. We took his samples, and by the time we came back 24 hours later, the fellow was already dead in the private hospital. He was receiving treatment. All protocols on COVID-19 burial will be observed as we speak on that. In the number, there's a possibility that this case would have been managed well if by our own team, if alerted on time. I urge you to cooperate with our efforts to protect lives. People who hide their medical conditions run a high risk of dying from COVID-19. Please, let us bear this in mind. Community COVID-19 Task Force. In Anambra, it is important to note that the rise in the reported case of COVID-19 in Anambra is as a result of the aggressive case surge mounted by the Special Task Force on COVID-19, headed by myself. Following the success of the task force at the state level, we have since extended our activities to the 226 wards in Anambra State for a more aggressive campaign against this pandemic. The membership of the task force at the community level are as follows. The officer in charge of a primary health care center at the ward, the community woman leader at the ward, the youth leader at the ward, the representative of the Ministry of Health, and the representative of the civil society. The team shall be headed by the councillor of the ward. but the local government chairman and his medical team shall supervise the activities of the entire team. In Anambra, I have no doubt that this structure will help us to ramp up more tests in the various communities and weed out the virus from our populace. We shall continue to innovate and seek new creative response to COVID-19 as time goes on. COVID-19 case management medication team. In Anambra, we have decided to set up a case medication team. This team is made up of seasoned medical professionals and public health officers who will deliberate and decide the best medical approaches to adopt on a case-by-case basis. Attitude to COVID-19 patients. It has come to our knowledge that some of our health workers turn automatically hostile to patients who they suspect to have COVID-19 symptoms. This is not acceptable in the state. We cannot encourage any attitude that will discourage possible COVID-19 patients from walking willingly into our hospitals to reveal their condition. I fully recognize the overriding importance of our healthcare workers who are on the front line of this battle against the pandemic. It is on record that I generously acknowledge the efforts of the health workers who handled our index case and the two that were just discharged, and assured them of some of the rewards I mentioned earlier. So we deeply appreciate our healthcare workers, but we must also discourage any negative attitude from them where it exists. It is on this note that I wish to appeal for a better understanding and empathy from our health workers and urge them to keep to their professional oath. Advice to hospitals in Anambra State. I wish to advise the management of all hospitals in Anambra State to create an isolation room where any patient whose sample has been taken for COVID-19 testing can be kept while the result of the test is being awaited. If a patient who is suspected of COVID-19 is placed in an isolation ward, it reduces the pressure we have to contend with in the volume of contact tracing that arises from allowing a suspected patient to roam freely while he's awaiting his test result. We expect all hospitals in Anambra State to comply with this directive and with immediate effect. Conclusion. In the Anambra, we have done well so far in the battle against this pandemic, but we can still improve on our performance and place their state in an enviable position in the ranking of COVID-19 status in Nigeria by doing all the things that we are expected to do to flatten the curve of this pandemic in the state. In the Anambra, we are giving this challenge our best efforts. The setting up of COVID-19 task force at the ward level will play a major role in increased detection and reportage of more cases of this pandemic in the state. Also, while there may be a sharp rise in the number of cases in the coming weeks, rest assured that we have enough capacity to handle what will come out of the increasing number of tests that we are doing at the community level. There is no need for panic. We are on top of this situation. By the grace of God Almighty, Anambra State shall come out safe from this pandemic. God bless Anambra State. God bless Nigeria. God bless you all. Thank you very much.